Hello, and thank you for listening in to the Early Childhood Colorado Partnership tutorial on shared measurement through results-based accountability. To provide a little bit of background on the Early Childhood Colorado Partnership, the partnership advances the mission of the Early Childhood Colorado Framework statewide by offering the space and conditions for diverse cross-sector partners to identify common results, share best practices, and implement strategies to improve system effectiveness for child and family well-being. The partnership is an open table where anyone and everyone dedicated to the mission and vision of the framework is welcome to join and participate. At the heart of the partnership work lies the effective use of data and evaluation to inform continuous quality improvement. And RBA, or results-based accountability, serves as the partnership's continuous quality improvement mechanism. So for this short tutorial, which will last about 20 to 25 minutes, we'll provide a brief outline of the results-based accountability principles and guidelines, along with highlighting how RBA framework is utilized by the Early Childhood Colorado Partnership. As we go through the webinar, I'll be highlighting the partnership's RBA journey throughout, so it's important to get some grounding. The partnership's work is grounded in 4 pillars. First, a collective impact approach. The collective impact framework highlights the need for working together collectively with certain conditions in place to achieve desired results, and one of those conditions is shared measurement. Second, evidence and research. A growing body of scientific evidence confirms the importance of the earliest years in life in setting the stage for long-term physical and mental health, social and emotional, and financial outcomes for children and families. Next, Colorado values. The Early Childhood Colorado Framework, serves as the network's common agenda, which is the foundation for early childhood systems work throughout Colorado. And finally, continuous quality improvement using a results-based accountability, or RBA as I'll call it going forward, framework, which is what we'll be diving more deeply into for this tutorial. Results-based accountability is based on the work of Mark Friedman in his book, Trying Hard is Not Good Enough. The premise behind RBA is that it gets groups from talk to action quickly. We've all been in processes where we feel that there's a lot of talk, a lot of discussion, but not a lot of action ever happens. And so RBA provides a discipline framework to ensure that groups can get from that talk to action quickly. For programs, ends are how customers or clients, whatever the term you might use for your end users, are better off. For example, the percentage of children screened in a developmental screening program, or number of families served, etc. And for a network like the partnership, the ends are the conditions of well-being for children, families, and the community as a whole. For example, children of all races and incomes are successful learners. That is one of the 4 shared results of the Early Childhood Colorado Partnership that we'll highlight a bit more later. Some things to remember about results-based accountability, or caveats, is that it's not a quick or easy process, and it's really a never-ending process. It takes time and thought. It does create a space, though, for a wide range of voices to be included. So given the time it takes, it does provide that space for all voices who need to be heard to come to the table. And the focus on data and data-driven decision-making allows groups to be honest about progress and whether or not change is actually occurring, rather than relying on intuition or anecdotal thoughts and research like we are often left to do. So to illustrate a common sense approach, the common sense approach of results-based accountability thinking and how we use it in everyday life, we can look at a common situation of a leaky roof. Hopefully this isn't a common occurrence for people listening in, but it provides a real-world example for us to apply to the results-based accountability framework. So first, you have to think about your experience. How can you tell if your roof is leaking? You might see water on the floor, you might see water coming down the walls, you might hear it in your house. That's kind of assessing your experience. Next, you want to measure how badly the roof is leaking or how serious your problem really is. So really, the measurement for this is how much water is in your house. So hopefully, if it's a small leak, you might think about putting a bucket out to measure the number of inches in the bucket after each big rainstorm that comes through. Hopefully, you do not have a deluge of water coming into your basement. You can see by the 3 data points on the graph here, which represent the number of inches from the last 3 rainstorms. So you can see a trend going up. And from that trend, you can assume that that line is going to continue to keep heading up if you don't do anything about it. Since you're not okay with a forecast that says you're going to have more and more water coming into your home, you decide to do something to turn the curve, as we say on this data line, and send it down towards 0. So next, you want to get up on your roof and try to figure out why your roof is leaking. And this is getting to your story behind the baseline, the causes of why this picture looks the way it does. So the baseline data is where we are and where we've been, whereas the forecast data is where it's going. So turning the curve takes you where you need to go. So in some data cases, turning the curve might be going upward if that's where you want the data to go, and in some cases, it's going downward. Next, you want to think about your partners or people who can help you to fix your problem. So in terms of a leaky roof, you might have a neighbor, a sister-in-law, a professional roofer that you know that has some handy skills that you can bring in to help you fix your roof. So these are some of your potential partners. And next, you need to consider what works to fix a leak. You might use patching material. You might need to get a whole new roof, hopefully not. And then the worst case scenario, you might need to sell your house. So you have some choices about the types of patching material. Some obviously might work better than others. For example, tar probably will work better than duct tape, although we like to think that duct tape is a universal fixer for all kinds of problems. So now that you've got a good picture of what's going on, the important final question is, what are you going to do about it? What is your action plan? Finally, you need to implement your action plan. Maybe you have hired a roofer who's gotten up on the roof and already patched it. And the next thing you have to do is wait for the next rainstorm to see if it's still leaking. If it's still leaking, you have to get back up on the roof and start the process all over again and try something else. This gets to the heart of RBA, that it's an ongoing, iterative process. Hopefully you fix the roof leak in one go, but the things that we are working on are often much more complicated than a leaking roof, and one iteration won't do it. So this provides background on the whole results-based accountability process and what's at the heart of RBA. It's really just common sense. It's how we solve everyday problems. And communities working to improve the quality of life of children or managers working to improve their program's performance can all use the same process. And if you notice that we identified the inches per bucket measure pretty easily. With a leaking roof, it's pretty obvious what's important and what could be measured. But something to remember with our work that applying it to more complex work is that programs and agencies, service systems, that kind of thing, the choice of what's important and what is most important to measure becomes much more complex, especially when you have a lot of partners and voices at the table. So next up, we'll spend a little bit of time defining and explaining indicators and performance measures and some of the various terms used in results-based accountability, and highlight how the partnership has gone through this process in the past and is currently experiencing. To highlight the ongoing nature of results-based accountability and how it's worked for the partnership, this little graphic can highlight kind of the journey the partnership has gone through. So the RBA journey for the partnership, to highlight just how ongoing and iterative it is, started a while ago in 2009. And through an ongoing process, the partnership determined the focus, population level results, data, and action. And as this graphic depicts, It's an ongoing cycle. It never ends, really. Even if we were to identify and achieve the outcomes we want, the results we want for young children, perhaps there are other pieces to move on to and move the needle in other places and continue to make sure that those outcomes stay strong. An RBA supports an ongoing and thoughtful process, one where the partnership often and routinely reviews earlier decisions about population-level indicators and discusses data trends in order to ensure the right strategies and actions are being taken based on the network's ongoing shared learning. So to highlight two of the core parts of RBA is distinguishing between the two different levels of accountability within results-based accountability. So one level is accountability for whole populations, or population accountability. For example, this might include all children of Denver, all elders in Fort Morgan, or all residents of Colorado. This first kind of accountability isn't the responsibility of one agency or program alone, which is why groups like the partnership exist, to bring different groups together to identify those common results and share accountability towards achieving those results. The other part of RBA is performance accountability. And this is about the well-being of the clients that you serve or end users that you serve. It's about the programs and services provided, our role as managers or directors or executive directors in organizations, making sure that our programs are working as well as possible. So as you can see here, these are two profoundly different levels of accountability and very important to distinguish between the two as you're working through the RBA process. So to highlight some definitions, I want to highlight the importance of going through definitions because language is very important when it comes to results-based accountability. We at the partnership use the RBA language laid out by Mark Friedman in his book, Trying Hard is Not Good Enough. But the important thing here is that whatever language you're using is shared among all of those individuals, organizations working on your results-based accountability project or experience. So the language you use needs to work for you and your context and help people distinguish between the different levels of accountability and how you're measuring them. So we use the word result, for example, but it could for you be outcome or goal. Whatever works for your project or program. So at the highest level, on population accountability, that level, we have results. So on the population level, which you remember is concerned with whole populations, we call a result a condition of well-being. An example might be children are born healthy, children are ready for school, safe communities, clean environment. You could go on and on, but those are population level, whole population level results. Indicators are measures which help you quantify the achievement of a result. So for example, the rate of low birth weight babies, percent of children ready at kindergarten entry, crime rate, etc. Low birth rate babies might help you measure or quantify whether or not you're achieving your results of children are born healthy. Performance measures are measures of how well public and private organizations and agencies are working. So the most important performance measures tell us whether clients or customers of the service are better off. We sometimes refer to these measures as client or customer results to distinguish from the population level results for all children and families. It's also sometimes useful to distinguish program performance measures from agency performance measures and from service performance measures. Again, the importance of language is huge here. And the principal distinction here is really between ends and means. So results and indicators are about the ends we want for children and families. And strategies and performance measures are about the means to get there. So how much did we do? How well did we do it? And is anyone better off? So populational level accountability, to dive deeper into that element of RBA. starts with outcomes for whole populations, and this level of accountability can be at community, city, national level, and beyond, as long as they're population level accountability pieces. So for a program serving young children in the city of Greeley, for example, your client population might be a smaller group, and so your performance measures would relate to those you serve. But your population level results and indicators, you'd want those to reflect the entire population of your city or whatever geographic area you're trying to serve, or other area. And these are not related to specific services, an important piece to keep in mind. So for the partnership, the population level results for the partnership were identified through that RBA process, and the partnership came to 4 shared results. Children live in safe, stable, and supportive families and communities. The second one is that families are engaged as leaders in their child's healthy development and education. Children's health and development are on track, and children of all races and incomes are successful learners. The partnership arrived at these 4 shared results by applying multiple criteria. So they needed to be population-based, simple, silo busting, so again, working across sectors that health and early learning and family support sectors could all identify with them, and solution building. So notice the broad level of these results, that they're across domains, and that they're co-equal with each other, and that one does not trump another or all of the others. For each result, the partnership has about 3 to 5 population level indicators that accompany. An indicator is a data measure telling you whether or not you're making progress towards your desired result. And we'll show the population level indicators for the partnership in just a moment. The partnership used this step-by-step process depicted in this image here to select the indicators. So the first step is to determine whether or not the indicator you're looking at is a population or performance measure level indicator. And then you must apply a set of criteria to determine if the indicator works for you. So communication, does it communicate to a broad and diverse audience? Proxy power, does it say something about the result? Example, evidence like 3rd grade reading results and that kind of thing. Data, quality data on a timely basis. And just to provide a caveat there, as I know the partnership has really, this has been the biggest, I think, challenge when it comes to results-based accountability for the partnership, is getting quality data on a timely basis. And so it gets to the heart again of that ongoing process that RBA requires, and that it doesn't happen overnight. And this is why we have a data development action team to help support the ongoing evaluation of how these population level indicators and results are working for the partnership, and figuring out what our data development agenda is. So if our biggest barrier really is getting quality data on a timely basis, how can we advocate and change that reality? So as you can see, this is the data development agenda for the partnership. You can see 2 of the shared results of the partnership, and each result has some headline indicators and also a data development agenda. So data that the partnership would like to get that would really get to outcomes for children and families that would help us achieve that desired result. And so this is the other 2 results as well. So the partnership engaged in turn the curve activities like we went through with the leaky roof example earlier, based on the population level results and indicators that were chosen and identified on that data development agenda that was just shown to you. This work first occurred in 2013, and the result was a 2014 focus map that looked similar to the one that you see here on the screen, although this is the updated one for 2015. And the focus map focuses in on approaches and activities for the year. After the first action map or focus map there, we changed the name this year to action map, but after the first focus map was developed, In 2013, action teams were developed. Existing work groups were supported from that map that took on more specific strategies and actions. For example, a speakers bureau on toxic stress was developed, and a literature review on toxic stress was developed. And in the 2015 action map, early in 2015, the partnership repeated those turn the curve activities, identified some new areas of focus for the partnership to look at during this year, and some new action teams and other areas of focus for the partnership have been identified and taken on this year. And here's where performance about accountability comes into play. And first wanted to show a couple pictures of the Turn the Curve activities that took place earlier this year in 2015 in February. The different groups took on different results and indicators, talked about the story behind the data, and got to some root causes. So for performance level accountability, this highlights how specific organizations, programs, or in the case of the partnership, a whole network within the work groups within the network, action teams can measure performance. So there are 3 primary questions to ask on the performance accountability level, and these 3 questions fit into a quadrant that can help us understand what we're really measuring about our program, agency, or service system performance. So if you notice on the upper left side, you'll see effort, and then on the bottom, effect. The effort is how hard we tried, and effect gets to whether anyone is better off. If you notice at the top of the quadrant, you'll see quantity and quality. So quantity is about how much we did, how much did we do, and quality is about how well did we do it. So when developing performance measures, you want to develop performance measures for each of these quadrants. This isn't to say that all performance measures are created equal, though. Measures in the top left corner that answer the question, how much did we do, are often what we report for grants. They're often the easiest things to measure, but it's really most often the least important in helping us to know if what we're doing is helping to positively move our indicators the right way to reach our goals. The most important and most helpful measure is the bottom right quadrant, which measures whether our clients or end users are better off. So this is also, as you can probably tell, the hardest thing to measure, and gets again to the piece of data that takes a long time to gather. So this doesn't always come easy. To provide an example, the partnership is actually just starting to work on performance accountability measures and really honing in on that piece through developing a shared measurement system for partners to dial into and identify what work they're collectively contributing to the whole, to the network, and also through action teams and work groups. To provide a more very concrete example of putting this performance accountability into action, you can use the example of a drug treatment program. So if you look in the top left corner, you can talk about how much service did you deliver, which might be the number of persons you treated. Again, this gets to something that is fairly easy to quantify, to measure, to track. Again, thing that is often asked from grant reports, but not necessarily the most important thing that gets to your population level results that you want to achieve. How well did you deliver it might be a % of your staff with training or certification in a certain program or model. How much change did you produce might be the number of clients off of alcohol and drugs at a couple different reference points, so when they exit the program and then a year after they exit the program. And then the quality of change gets to the % of clients off alcohol and drugs, again, at those different reference points. Those pieces, again, are the hardest to measure, hardest to quantify. Often it's hard to track that. It takes time, it takes money, not a lot, some things that many of us don't have. So that provides a brief background of the RBA framework and how it applies to the partnership and can apply to other programs and initiatives. For questions about the RBA Framework and how the partnership uses the RBA Framework, you can contact Early Childhood at civiccanopy.org.